Shall we start the class?
Yes, sir.
Okay. Okay, let's start. So last time we discussed about the pathology of nervous system. These people, students are also. Okay, I will not allow anybody else. So today we'll continue about the pathology of this nervous system. So today we'll discuss about the remaining part, that is inflammation of the nervous system. So first one is encephalitis, that is inflammation of the brain. That means the whole parenchyma, involving the whole parenchyma of the brain. Then it is known as encephalitis. Then next is myelitis, when the inflammation is restricted to the spinal cord, means only the spinal cord is showing inflammation, then it is known as myelitis. Okay, so when this both, brain and spinal cord both are inflamed, then it is known as encephalomyelitis. Okay, then next is encephalomeningitis, that means inflammation of the brain as well as the meninges, the covering layer, okay, of the brain. If it is inflamed together, brain and the meninges, then encephalomeningitis. And one more complicated little bit, this combined terminology, that is meningoencephalomyelitis. That means if the inflammation is of the meninges, the brain, as well as the spinal cord altogether, then it is known as meningoencephalomyelitis. Then now, the first one about the this meningitis, little bit description about this. What happened is that in this case, when the animal or even in case of this human also, when they are having this inflammatory reaction to the meninges, okay, the protective membrane which covers the brain and the spinal cord as a whole, these meninges are showing this inflammatory reaction. In this case, there used to be very much irritated this irritation to the affected animal. Because of this nervous irritation, this in the meninges and all, so they used to have a very irritating type and very painful as also, and as well as the irritation and all. So because of that, the affected animals used to show head pressing. Means it is like when they are pressing their head to some stationary objects like wall or post and something like stationary objects. So they used to feel that they will get relief from this irritation. So that's why they used to show head pressing, as I am showing a photograph here. Okay, so this kind of this head pressing of the affected animal is one of the indication that the animal is having the problem of meningitis. Okay. And the causes of this inflammatory reaction may be encephalitis, meningitis, encephalomyelitis, encephalomeningitis, and all. So the causes are of similar type. While many these infectious agents like viruses, bacteria, as well as this drug toxicity and all these things, right? And when according to the different part layer of the this meninges, okay, the brain. So it has been, these two, these different types, that is patchy meningitis, when the inflammation is restricted to the durameter layer. Okay, that is known as patchy meningitis. And when it is, restricted, confined to the pyometer, then it is known as leptomeningitis. Okay. So these are some of the this photograph pictures showing different this meningitis, septic meningitis here, then suppurative meningitis with pus formation, abscess and all. Then here this ventral portion of the brain showing this purulent type of this meningitis. Okay. Then another this brain showing diffuse meningeal congestion. Okay. Severely congested, this meninges, the outer covering of the protective cover of the brain. Then now This meningitis, as we have already discussed, that it is the nothing but the inflammatory reaction, inflammation of the meninges, which usually occurs along with the brain inflammation. That is what we call encephalitis or encephalomyelitis in the form of, right? And this may be congested, this characterized by whenever you have this problem of this meningitis, so you will have this severe congestion of the brain, as I'm showing here, then with infiltration of some inflammatory cells like neutrophils or some this mononuclear cells like lymphocytes. Okay, and it can be caused by traumatic injuries or infections like swine fever virus or this Vena virus. Then these bacterial organisms like Pasteurella, Listeria, then Toxoplasma, Leptospira and all. So these are some of the common etiological agents which can cause meningitis. And if you check the gross lesions, so automatically means there used to be congestion and very much thickening of the meninges with pinpoint hemorrhagic lesions. Okay, pinpoint hemorrhagic lesions. Then if you go for microscopic section, then you will have the blood vessels in this brain section, and particularly this your meninges part and all. So all are congested, and there will be infiltration of inflammatory cells like neutrophils and lymphocytes, and in some little bit chronic cases you may have the problem of fibrosis. Then next is about encephalitis, that is inflammation of the brain, maybe purulent type, lymphocytic type, or even purulent proliferative type of this inflammatory reaction. And if it is the inflammatory condition of the brain as well as the spinal cord, then we call it encephalomyelitis. So the etiology, the causes are bacterial organisms like Listeria, monocytogenes, then this Haemophilus, Pasteurella, the viral infections, Mycoplasma, then strychnine and this poisoning and all. So these are some common etiological agents. So these are, some transmitted this cycle of the Japanese encephalitis is my heart. So these things, you learn, this in details later on in the diseases. Okay, Japanese encephalitis caused by a virus. Okay, and transmitted through the this mosquitoes. Okay, through the vectors like your this pig and other some these animals. Okay, then to the human, it means it is highly genetic. You might have heard about this Japanese encephalitis. Okay, then the gross changes of this encephalitis also, if you see the brain, the affected one, then you will find the brain is highly congested. Some hemorrhagic lesions may be there, maybe petechial or some ecchymotic type, or sometimes there may be some presence of this small, very tiny, this abscesses. Okay, very small, this tiny abscesses, and necrotic lesion of the brain and this parenchyma, that what we call encephalomalacia. And there may be encephalomyelitis as well as meningoencephalitis. That means not only the brain, means it may be extended towards the, your sheath, meninges, the protective covering of the brain and the spinal cord. So along with that, if it is, having this inflammatory reaction, then what we call encephalomyelitis and meningoencephalomyelitis. Okay. And many of these signs and symptoms used to be, and as I have shown you, that this head pressing, then this falling down under this incoordination movement, ataxia, then this paralytic condition and all these things. These are some of the signs when any lesion in the central nervous system. That means your brain, spinal cord, and meninges. So nervous signs like your this incoordination, ataxia, then stationary movement or paralysis and all. These are the main clinical signs and symptoms. Even sometimes you may have the problem of convulsion and fit. Okay. Then these are some microscopic pictures of the this inflammation of the brain, what we call this encephalomyelitis. So sometimes, as I have told you, that there may be presence of some small this abscesses. So there means you will find in this aggregation of these neutrophils, okay, in the cerebrum. Then this along with that, sometimes some neutrophils, lymphocytic cells, mononuclear cell, lymphocytic cells may be there. And when you see the Bursell-Robin and this space, so in just around the vessels, okay, the blood vessels, you will find aggregation or infiltration of mononuclear lymphocytic cells. So this condition usually happens in the Bursell-Robin space of the blood vessels in the brain tissue. Okay, and this very particular, coughing or this infiltration or presence of this mononuclear inflammatory cells by this lymphocyte. So that is termed as perivascular cuffing. Peri means around, vascular means the vessel. So just around the vessel. So aggregation or infiltration of any this lymphocytic mononuclear cells, these lymphocytes used to be there. So that is known as perivascular cuffing. So any case of the brain injury, when there is encephalomyelitis, and meningitis and all this, so you may have this problem of this perivascular cuffing. Then maybe this necrotic lesions of the neurons, okay, what we call encephalomalacia. Then satelitosis and neuronophagia. That means that tissue, the cells, neurons, and all this, they used to be surrounded by this phagocytic cells. Then they used to be removed by these phagocytic cells and all. That what we call satelitosis surrounding. Then neuronophagia, engulfment and the removal of that neurons. Okay. Then pleocytosis, another terminology, means you may come across. That means if you make the section of the this brain, and if you go for counting the white blood cells in the cerebrospinal fluid and for examination and for proper this analysis and all, so you may get increased number of these white blood cells, WBCs, in the CSF, cerebrospinal fluid. So that is termed as pleocytosis. Okay. And now necrosis of the nervous system. So necrosis of the brain is actually termed as encephalomalacia. So when it is confined, restricted to the gray matter, then it is known as polyoencephalomalacia. If it is in the white matter, confined or restricted to the white matter, then leukoencephalomalacia. If it is in the spinal cord, myelomalacia. So these are the three, this different type of this necrosis in the nervous system. And the three type of these skin basal cells may be observed and may be found in the nervous systems. Those are microglial cells, oligodendroglial cells, and astrocytes, as I'm showing the different pictures here. And these microglial cells used to surround the necrotic neurons, and they are known as satellite cells. And the process of surrounding the dead neurons by this microglial cell, that process is known as satellitosis. And when these dead neurons, which has been engulfed by the microglial cells, what we call satellitosis, the process, then the dead neurons used to be engulfed and removed by the microglial cells. Then that process is known as neuronophagia. And the necrosis of the nerve fibers usually starts from the myelin sheath, and this change is known as demyelination or Wallerian degeneration. That means, when necrotic lesions of the nerve fibers starting from this myelin sheath, so that is removal. There will be removal of the myelin sheath. That's why demyelination. Okay, or it is also known as Wallerian degeneration. That means there will be some degenerative changes in the nervous tissue. Then now coming to those these necrotic lesions, encephalomalacia and myelomalacia. So malacia means softening and the necrotic lesion of the nervous tissue in the central nervous system. Then malacia, injuries to the central nervous system, including your encephalomyelitis, trauma, anoxia, etc. Okay, so this terminology, this malacia or softening of the gray matter, as we have already mentioned, that means polymalacia. Then when it is in the ground, this white matter, Then what we have already discussed, leukoencephalomalacia. So as I am showing the different these parts of the brain, white matter and this gray matter. So according to the different part of this brain and this necrotic lesions used to have different terminology. Okay, gray matter, polioencephalomalacia. When it is restricted to the white matter, then leukoencephalomalacia. Okay. Then this encephalomalacia, that is the necrotic lesion of the nervous tissue. So whenever there is a necrotic lesion, means necrosis means local cell death. So here your nervous tissue, I mean the neurons and all that, I mean already that, right? So that's why there will be loss of normal architecture of the brain tissue. When you see under the microscope, you will not be able to say that this is nervous tissue. I mean that very particular necrotic lesion, but from the surrounding where it is intact, I mean there is no necrosis. From there, by seeing the neurons and all these things, microglia cells, or like, I mean you can say it is a brain tissue, right? Otherwise, that very particular, I mean this part where necrosis is already there. So there means you cannot recognize because of the loss of normal architecture. And it used to be usually very soft, friable and liquefied mass. Normally means in this brain tissue, whenever necrosis used to be there, this used to be of liquefactive type of necrosis because of the, I mean this CSF and the watery nature of the this brain. So there means you will have this very particular type of this liquefactive necrosis. Okay, and it used to be mainly caused by deficiency of copper, thiamine, vitamin E, or as in case of these poisons like Breckenburn toxicity, lead, mercury, salt poisoning, enterotoxemia, as well as even mycotoxins, as in case of this, I mean this aspergillosis. Okay, then if you see the gross lesions of the encephalomalacia, so encephalomalacia, that is very particularly the whole entire this brain necrotic lesion. When it is confined to the spinal cord, then myelomalacia. If it is in the gray matter, as we already means we have talked about this encephalomalacia or poliomalacia, or if it is confined to the white matter, leukomalacia or leukoencephalomalacia. In different these two terms it may be, but it is same. Poliomalacia or polioencephalomalacia. Okay, or leukoencephalomalacia or leukomalacia. Means according to the this gray matter or white matter of the brain is affected, showing necrotic lesions. And in any case, I mean the brain and this tissue as a whole, I mean you will find it is highly congested, soft, friable, and liquefied mass will be there in the this brain tissue, because liquefactive necrotic lesion always used to be there in the brain because of the this content of this CSF. And microscopically, you will find is means I mentioned you that liquefactive necrosis means you will find liquefactive type of the necrosis where you will find many numbers of neutrophils. That is the indication of liquefactive necrosis. And this area, the necrosis area, used to be surrounded by many neuroglial and neurological cells like scavenger cells. I mean those inflammatory cells like macroglial cells, oligodendroglial cells, and all this, right? And there may be proliferation of new capillaries, newly formed this blood vessels, new capillaries, small capillaries. And now one question: why necrosis of the brain is almost always liquefactive in nature? As I have already mentioned you, that means brain, if it is necrosed brain tissue, then always it used to be of liquefactive type. Why? So the reason, the answer is, when necrosis occurs in the nervous system, the autolytic enzymes which has been released from the lysozymes of the dead cells, means those dead neurons and all these things. So it used to cause this integration of the myelin into a liquid mass which consists mainly of lipoid. So that is number one reason. Then number two is infection is one of the common causes of liquefactive necrosis. That means pyogenic bacterial organism used to be the main reason, and for producing this inflammatory reaction there in the and from there lysosomal enzymes which has been released from those inflammatory cells, that is phagocytic cells, this neutrophil, they used to induce liquefaction of the myelin, this neuroglia, as well as the other structures. Then number 3 is, of course, means it is not mentioned here, that is presence of your central cerebrospinal fluid. So these are the reason why this necrosis of the brain used to be always liquefactive in nature, right? Then next is neuritis. That means inflammation of the nerves, means individual nerves, means you may have sciatic nerve, maybe brachial nerve, or different, and these nerves are there according to different anatomical locations and all, right? So in that case, if a nerve is showing inflammatory reaction, that is known as neuritis. So it may be occur where it may occur along with degenerative changes of this very particular nerve, which used to be characterized by some edematous swelling of this nerve with infiltration of many inflammatory cells, and it can be caused by toxins, traumatic injuries, viral infections, like one of the most common and this viral infection in case of this poultry birds, that is known as Marek disease virus. Okay, and then this lead and this mercury poisoning, then bacterial organisms like strangles, as well as deficiency of vitamin E. These are the main common causes for neuritis. And this photograph I am showing you about the Marek disease in poultry birds, even species, but mainly the poultry. So there means you can have these are the brachial and this plexus of sciatic nerve, sciatic plexus. Okay, and sciatic plexus, so sciatic nerves. Okay, going towards this limbs. I mean your limbs, two limbs. So when it is inflamed, for example, this side, if you compare, this side is an inflamed one. So as compared to this is too much enlarged, almost twice of its normal size. Or sometimes towards the wing, like brachial nerve plexus, like that, means you may have inflammatory reaction of individual, just nerves showing neuritis, inflammatory reaction. Okay, so this way means you may come across the neuritis and inflammation of particular some nerves also. Then abscesses in the central nervous system. So these abscesses always, I mean, it used to develop as a result of some, I mean, these other pathological conditions, right? I mean, your embolism, then by direct implantation or by direct invasion of the brain from the adjacent structure. Means mostly here, any case of this suppurative inflammatory reaction or abscess formation, always one thing, always you should remember, it should be in your mind that there used to be pathogenic bacterial organism mainly. Some this past forming organism involvement used to be there. Okay, so that may be coming along with the, for example, when in the blood vessels, supplying blood to the this brain, there some embolism is there. Okay, then or directly it can be implanted in the brain, or sometimes means due to invasion from surrounding adjacent structures of the brain, means spreading towards coming towards the central nervous system, where they are implanting and producing or developing the abscesses there. So in general, these abscesses are very more common in the white matter of the brain than the gray matter. And these abscesses, when these abscesses are multiple, okay, in many numbers, so many these abscesses are there in the brain, so the animal used to die, and that is the outcome after a rather short course. Usually this brain failure and this damage used to be there, and the animal will die. Okay, then now I'll give you some this common diseases involving the central nervous system, and here itself I'll tell you a brief idea about these important diseases of the central nervous system, which used to be there in the specific this pathology in the list of these diseases. Means we are continuing this discussion about the this rabies also we have already discussed and all, like. So means here I'll just give you some diseases involving the central nervous system. Number one is about listeriosis, commonly known as circling disease. So it is a sporadic bacterial disease of animals, mainly caused by Listeria monocytogenesis, and commonly means the disease used to be manifested, characterized by encephalitis or meningoencephalitis in the adult ruminants. And there will be septicemia with focal hepatic necrosis in the young ruminants as well as monogastric animals. And the affected animals used to show abortion. I mean, the gravid uterus also used to be affected. And this kind of this disease recently it has been recognized as an important, very this public health problem. It means it is having genetic importance, and it may occur in the adult sheep with right facial nerve paralysis, drooping ear, right ear, then right eye showing, this no reaction to the flash or atony of the right nostril. So this kind of this nervous signs used to be there, and they used to move around. When this infected animal having affection of the encephalitis, the brain as well as the this spinal cord. Okay, the meninges, the spinal cord as well as the brain itself. So then means the animal may have this circling when they used to move in circle. Okay, so that is known as, that's why it has been given the name circling disease. Then rabies, as we have already discussed, I will not just give more this time here. We have already discussed about this rabies, and commonly means in human particularly, of course, in animals also sometimes it is commonly known as hydrophobia, because the affected humans mainly, or sometimes in some case of they used to have a fear of water. When you offer a glass of water and all, so they will feel thirsty, but they cannot take it because of the paralytic condition of the muscle of deglutition. Okay, pharyngeal, these muscles and all, and the muscle of deglutition, so they cannot swallow it. They will be having very much pain spasm and the painful spasms. That's why they cannot drink it, and if they try to drink, and also they will feel very much bad. So they will be showing very much fear of the water. So it is given the name hydrophobia. Okay, and details we have already discussed in the disease rabies. Then transmission and all these things we have already discussed about the gross lesions. and the gross lesion is not having that much important, but microscopic picture of the demonstration for the presence of this intracellular cytoplasmic inclusion bodies in the neurons, particularly in the hippocampus of the canine species, whereas in case of these cattle, in the Purkinje cells of the cerebellum and all those things we have already discussed the picture and everything, right? So I will not take much time here. Then next is funeral cerebralis infection, or commonly known as GIT or Stadia. I hope in the practical class I have shown, this GIT, the one sheath in this small bottle, I hope, and there we have already discussed. It is one kind of this, this parasitic infestation, the larval stage of the parasite, this tapeworm Tinea multiceps. Okay, and that is commonly known as funeral cerebralis, the infective larval stage. So when such kind of this, this infection, affecting the these animals like dogs, cats, and wild carnivores and all, and they used to carry it, and this when it used to affect mainly, the sheep or sometimes in cattle, and rarely of course, and they may show the this sturdy or giddiness, and even here also circling movement. It is very common. Okay, so they may have the problem of muscular stiffness, spasm and tremors, trembling, then prolapse of the nictitating membrane, and very high sensitive hyperesthetic. Even to noise or touch precipitates the tetanic like spasm, and very much sensitive, hyper and sensitive like aesthetic. Okay, then on walking, if you force them walk, the leg may, this very much show there's very much stiffness, and they may turn without flexing their spines, and ultimately they cannot walk, and they will lie down in the lateral recumbency with legs out stiffly, as I'm showing here, legs out stiffly and head extended back, sometimes twisted or extended back a little bit, and the rectal temperature also used to be high by this muscular activity because of the tremors and all this trembling and this convulsion also sometimes, right? So this is another picture of this the location of the cyst, where the cyst was there. Like, I mean, in the practical class, I have shown you a cyst, I mean, containing many this graviduterous, I mean, this your scoliosis. I mean, so many this scoliosis, gravity scoliosis used to be present inside the, I mean, this cyst, some granular like this structure. I hope, I mean, in the practical class I have shown you. Okay, so that kind of this condition, I mean, so because of that infective larval stage, I mean, and this what we call cuneus cerebralis of this tapeworm tinea multiceps. So it is also known as cuneus cerebralis infection, or commonly known as git or sturdy. Okay, this is, I mean, about that, I mean, this disease. Then next is another disease, means of course in the list of your, I mean, this in the syllabus of your disease also, I mean, it is there. It is another important, so far the examination is also concerned, and that is nothing but bovine spongiform encephalopathy, in short BSE. One group of this disease caused by prions. Okay, proteinaceous infectious particle, not exactly and virus, a virus or bacteria or any other. I mean, this, it is infectious, infective, I mean, form of your protein, proteinaceous and infective particle, commonly known as prions. Okay, and for the discovery of this very particular, I mean, this particle and this infectious particle prion, Professor Stanley Prusiner got, I mean, this Nobel Prize in the year 1987. Okay, I mean, for discovery of this prion. Those things, I mean, the history is there, and this very particular, I mean, this, I mean, disease is known as mad cow disease. It is a very chronic and febrile, very much degenerative, and this degenerative disease affecting the central nervous system of the bovine, I mean, mainly the cattle. So commonly known as mad cow disease, because they used to show madness syndrome, as like your rabies and all. Okay, I mean, the salivation, excessive salivation, then convulsive movement, then paralytic condition, aggressiveness, okay, unmanageable, I mean, this behavior, and bellowing, I mean, this, you know, I'm just one kind of this crying type of this sound produced by the affected animal. Okay, those, I mean, type of this disease. So this is highly fatal, I mean, this variable, this fatal disease condition of the domestic cattle, belonging to the group of this disease known as transmissible spongiform encephalopathies. It is a group of disease caused by prion. These are commonly known as prion diseases. Okay, so these diseases are defined by the pathological accumulation of the host by encoded protein designated as PRP. And this, I mean, your prion protein, I mean, principally in the central nervous system or sometimes in the lymphoreticular tissues. So this kind of this protein, what we call prion proteins, one kind of encoded this protein, I mean, from the, I mean, this normal protein, cellular normal protein, it used to be transformed, okay, so into infectious type of this protein known as prion protein. So this is the only detectable macromolecule associated with this infection of this disease. And the brain used to show this many empty vacuoles, as I am showing here, what I'm just oval or little bit circular, and this spaces, okay, where there is no any stain, and completely this empty and all. These are the empty vacuoles. Okay, so the brain tissue used to show the presence of so many these vacuoles. So the brain as a whole, the grossly used to be spongy in nature. That's why spongiform encephalopathy means affecting the this brain. Okay, this is of brain. So means encephalopathy. So it is in spongiform in nature, in the grossly when you just see the examine the affected brain. So that's why it is occurring in bovine spongiform encephalopathy. When it is in feline spongiform encephalopathy, like that. Okay. So this etiology, as I have already mentioned you, that caused by this prion. So first case of this bovine spongiform encephalopathy was, I mean, described and this recognized in the year 1985-86 in Surrey, United Kingdom. Okay, reported. Then means it has been spread out. The animal products or the threat of these animal infected animals, particularly the nervous tissue, okay, or sometimes some lipolytic tissue and all, and the animal this offals and all these things when they have been this met the animal these rations containing these bone meals and the meat meals and of these affected animals and all, mainly the brain tissue. Whenever the central nervous system tissue is there, of course, so that may be containing these infective prion proteins, and if it is, that is when the main source of this infection. Okay, and some kind of this, or what is it is very much zoonotic importance of this disease is that from this type of these diseases, some new variant of this disease, prion proteins infection to the human and having highly zoonotic importance due to oral exposure. That means due to ingestion of the infected meat, okay, of this kind of this and this infectious prion proteins and all, commonly known as new variant Creutzfeldt-Jakob disease (CJD) in humans. Okay, that used to be even there in case of, that means it is having your this highly zoonotic importance, and it is a chronic, this progressive type of this chronic and this viral and this infected disease in case of these humans also. That means it takes time, and that even many years, means after infection you may start showing the signs. It's not like your this rabies. I have already given you about the history of 19 years and the few months and all. Okay, after infection, they start showing the signs and symptoms like that. This disease also used to be very chronic and highly this progressive type of this central nervous system. This involvement, right? So this protein, as I have already just told you that when the cellular protein, okay, the Professor Stanley Prusiner named this protein as prion. The proteinaceous is infectious, this particle or only, okay. So this type of this normal cellular protein, so that used to be converted into this cellular this infective protein, this protein, what is called in this prion protein. So when you see that this kind of this conformatory change from the normal cellular protein surface, okay, protein. So what transformation used to be there, conformatory, this conformational transformation used to be that alpha helix of the normal cellular protein. So that used to be replaced by beta pleated sheets like this. Okay, the normal beta pleated, this alpha helix of the normal cellular protein, that used to be transformed or replaced by beta pleated sheet that is abnormal. On this kind of transformation, then it become the infective this protein form, what we call prion protein. Okay, so these are some more these pictures about this, means please go through it. This all this how it used to go into the system and affecting the neurons and all. Okay, whenever getting into the system, they used to they enter through the brain along with the axons of the neurons, and another route is through from through the blood or sometimes through the immune cells. This kind of this infectious protein particles can enter into the body and affecting the central nervous system. And under this same this transmissible spongiform encephalopathy caused by these prions. Okay, so another important disease is scrappii, which is also known as ovine spongiform encephalopathy. That means in ovine these families, okay, species. And this is another this important this transmissible spongiform encephalopathies affecting the this ovine species, where neurodegenerative affection of the sheep and goats used to be there. Similarly, you will have vascular and spongy changes in the central nervous system used to be there. Okay, it is a very almost recognized more than 250 years ago, and has been started this disease from the Spain. Okay, so this is another this important disease and the transmissible spongiform encephalopathy caused by your this prions. Okay, and it has been this suspected that and thought that the infected meat of this sheep with this prion, infectious prion particle, and the dead, these carcasses, or like sometimes the neuron, the brain tissue, or the offals or meat meals, bone meals, and all these things, which has been utilized for the preparation of the ration of the cattle. Then from that, the cattle used to, have this infection and all. So it is, this presumption and the thought, by this scientists. Okay. So that is means I will not go in detail. Similarly here. But one thing, in this case, in case of this scrapie, the name scrapie, scraping, the animal used to have very much itching sensation because of the affection of the CNS, central nervous system, brain, as well as the spinal cord, even the meninges and all, demyelination also will be there. So the affected animals used to show very much, this itching sensation, very typical and very serious, this itching pruritus, we'll know, and we used to say. And because of that, the body surface, the wool and all these things, when they are having this too much this itching sensation and all these things, they used to go to the stationary object like wall, post, and all these things, and they used to scrub and rubbing their body surface to relieve from that itching sensation, pruritus. Okay, so because of that, there used to be alopecia falling down on the wools, and on the body surface there will be so many these places, spots of the alopecia. Means no wool. No wool is there totally. That kind of this condition. Let me show you the animals like this. See, these are the species spots because of the alopecia. This severe itching, and they used to rub, and they used to have the falling of the loss of this wool here. This. So this much of this very typical condition used to be there. That is very much this typical. And along with this, you may have the problem of course, ataxia, incoordination, convulsion, even sometimes little bit pressing type of this head also it may be there. Okay, then little bit circling type, not exactly. So, but if you collect the affected brain tissue, then means it will be spongy in nature. And if you make the section, there similarly means you will have so many these empty vacuoles. So because of that, the brain used to have this spongy nature, right? So this is about the pathophysiology, as I have already described. About the the possibilities and what clinical signs and symptoms and all. And finally, the animal may have the problem of this polydipsia, then polyuria and all these things, and the paralytic condition, and then and this comatose and death finally. Okay, means it may be also in distress conditions. Then these are some this intermediate host of the tinea species. As last time in the practical class I have talked you about cysticercosis. I hope still some of you might be remembering that. And cysticercosis caused by many this intermediate this larval stages of the tinea species. I have given the example of tinea saginata and tinea solium in the this cattle, as well as in case of this pig. Okay, and by consumption of the infected meat by this infectious larval stage, as in case of this tinea saginata, cysticercus bovis, and in case of this tinea solium, cysticercus cellulosa. And I have given the example of my case also, like about this neurocysticercosis and all this thing. So like that, so many these other this species of this tinea, this tapeworm tinea, and with their final host and their larval stages and the intermediate host, and mainly the affected side of the body. This affected animals or humans also, like those, and I'm just giving here in this table. Okay, please go through it, and that is for your this kind of information. Okay, and this chart is I have told you. I have told you that this consumption of the contaminated this food and water mainly, or sometimes the meat and all. So mostly the human used to get infection. This this cysticercosis. I'm just showing this one is about the this cysticercosis through this infected meat of the pig or this pork. Then the contaminated and this vegetables Okay, I mean other food and water also, like I'm showing here the vegetation contaminated with the infected and larval stage, and this excreted through the human, infected human. Then it used to go and this consumed by the pig or the this man. Then they used to just get this infection, and in the pig they used to go in the muscles. Okay, then this pork meat, I mean when it is uncooked and properly not cooking, and this consumed by the human, or this raw this consumption, or this uncooked, or this not properly cooking, and this meat are consumed by this human channel, human used to get infection. And one auto this infection also used to be there after getting this consumption of this directly from the this in the human. By chance they used to transfer this towards the brain and all these things, and the brain can be affected, and then that is the case of this neurocysticercosis. And those human having this infectious this tinea solium, in adult forms in the intestines, they may have only some this little problem of this diarrhea and all this in chronic diarrhea and all. They may not die from this, and they may remain as a source of this infection carry. And this very particular human, the person carrying this kind of this adult tapeworms in their this intestines and the digestive system, they're mainly in the intestines and all. So they used to carry this this tapeworm, and from that means the gravid this scoliosis, the segments used to be set up and coming out excreted through the feces of this infected animal, and they used to maintain this cycle. Okay. So this is another this picture showing how human used to have this infection of this cysticercosis. Okay, through the consumption of the this many this food item, fast food items in the human, or like contaminated foods or water in the very remote and this places and all these things, right? Then these are the cycle showing about the life cycle of the tinea saginata, as in case of this cattle, beef consumption and these consumers. Then as in case of this tinea solium, as in case of this pork, these consumers, the chances of getting this infection. Okay, and the larval stage of this tinea solium as well as the tinea saginata, right? So these are another this cycle of the cysticercosis ovis. In case of this, this sheep and goat, through the this dogs and all, right? So these are some of the pictures. As I have shown you some pictures there in the this practical class also, and the infected meat. Okay, goes by the cyst formation in the meat like this. Then after the death of the this larval stage of the parasites and all this, they used to remain as a grayish white these areas, calcified areas in the meat, maybe in the beef or in the pork like this. Okay, and the cyst kind of this measle like this cyst used to be measly. That's why measly beef or measly pork, it is known as, it looks like measles, in case of this human, measles with feel vesicular lesions in the face and all this. You might have heard, I think, about this measles. So like that in the meat surface, when you cut the surface of the meat or the organs, you will find such kind of this measle like this vesicular this cyst. That is, these are nothing but, so these are known as, if it is in the beef, measly beef, then if it is in the pork, measly pork. So if you go to the market for purchasing this meat, then you have to inspect the meat, or you have to examine whether this kind of this measly this condition or the cysts are there or not. So you should avoid it. When a great chance of this infection is there, then you may have the problem of this cysticercosis, neurocysticercosis. Even it is highly fatal if it is affecting your brain or some vital organs like your heart and brain and all this, right? So these are some more pictures of the cysticercosis, cyst formation in different organs and tissues, and the affected humans when you undergo CT scan and the MRI and all these things. So this is the gross lesion of the where the cysts are there, and the multiple cysts used to be located in the brain. And if you undergo this CT scan and MRI, so you may have, and you will notify, they demonstrate the locations where this edematous swelling with presence of this cyst inside the this brain. Okay, or this your this calcified, or it is already there, then calcified regions and all. Okay, so that's all about the central nervous system, pathology of this central nervous system, right? And we have this 2 3 more and this system, cutaneous system, then special organs, and your this immune system, or what is that? Some more is left. Okay, like that. I mean, in the diseases part also, I mean, I will just try to make fill up and just take up some important diseases in brief. Otherwise, time is very short. We will not be able to complete the syllabus. And I will give you some notes later on. I mean, I'm just preparing. I'm just making PDF and all these things. Where this you can go through it simply, and you can have the idea about those things like toxicities, metabolic diseases, parasitic diseases, and all this, because we are not in a position to complete all syllabus. Okay, that's all for today. So okay then, thank you.